Welcome to This Week in Health IT News, where we look at the news that will impact health IT. My name is Bill Russell, Healthcare CIO coach and creator of This Week in Health IT, a set of podcast videos and collaboration events dedicated to developing the next generation of health leaders. This week, I'm doing, as you know, a series of interviews with health system executives who will share what their plans are for COVID-19 preparedness. If your system has a best practice to share, please shoot me a note at bill@thisweekinhealthit.com, and we will do a 10 to 15 minute Zoom video recording that will hopefully benefit the industry. I want to thank Sirius Healthcare, who reached out to me last week and asked me if they could sponsor a series of these conversations to help the industry prepare. And I appreciate their foresight in this matter and their commitment to the industry that they serve. Today's conversation is with Dr. Stacey Johnston of Baptist Health, Jacksonville, Florida. Good afternoon, Stacey, and welcome to the show.
Thank you so much for having me.
Yeah, thanks for taking the time to meet with us. I know you guys are putting in long hours, working diligently to get everything right for the community. So I'll just get right to the questions. The first question is pretty general, and it's what is your health system doing from a preparedness standpoint? So what are you putting in place for your community, and what kind of things have you been asked to do?
Sure. So we've started having daily calls with our system leaders, and that includes physicians, IT. It includes other neighboring hospitals and facilities, so that we're creating a coastal community approach, so not just a Baptist organization, and involving all of our physicians as well too. And on this call, we discuss some of the items that we're doing as a health system to enable the care for our community. And for instance, we are setting up a drive-through testing center. It's set to go live starting tomorrow morning. We have our dry run today. And with that, we have our ED partners working as the physicians running this program, and it will start with a telemedicine visit in order to do the initial screening. And based on the screening, a laboratory test will be ordered for COVID-19. At that time, if they meet certain criteria from an epidemiological standpoint, that specimen will be sent to the Department of Health. However, the physicians have the capability of ordering the test to be sent to LabCorp if they do not necessarily meet certain criteria but are still at high risk of having COVID-19. And we are actually, our healthcare IT is helping to collect the specimens. And so we are having a nursing shortage, as we've had several nurses go in isolation because of prior exposure. And so many of our informaticists have a nursing background. We have been asked to volunteer, and amazingly, all of our informaticist nurses have all volunteered to help run the specimen collection through our drive-through program, utilizing telemedicine as well too.
That's amazing.
Yeah.
So let me ask you two follow-on questions to that. The first is the community response to it. I mean, because this is a all hands on deck community kind of thing. So you're coordinating with people that you would normally be in competition with. How far does that reach? Is it just within Jacksonville, or are you reaching beyond that?
So we're approaching this as kind of a regional. So in Southeast Georgia, we will be able to do their testing as well too. And Jacksonville Baptist covers 5 counties. And so we will extend into all 5 of those counties and be this centralized testing center that people can just drive up, get their testing, and then go on their merry way. And then we're creating that feedback loop of how, again, the Department of Health will notify the providers that they get the testing, and then our ED providers will then do the feedback for those that were sent over to LabCorp.
So how are you keeping up with all that? So, the federal and the state, your multiple counties, multiple states, they're relaxing telehealth guidelines, they're relaxing. How are you keeping up with just the onslaught of information that's coming your way?
So we're all dividing and conquering. We have our informatics side and our IT side looking at the ONC regulations. We are actually starting to utilize FaceTime for our inpatient providers to see the COVID high-risk patients as well too for admissions. That's one thing we are just now starting to look into. We are expanding our telemedicine capability and for our hospitalists, our primary care physicians, as well as our Age Well Center, which is our senior center. And we are also utilizing, so we've talked about telemedicine. One thing we're also doing is we have bought some equipment that will have us capable of doing the testing in-house. We are waiting on FDA approval for the reagents, which we expect will come next week. And when we have that capability, we've built an order in the system already. And then once that order is built, then we will have to interface it back into our EHR for that, again, that closed loop communication of the laboratory results. So we've been making changes to the testing and the orderables on the fly. We've been doing real live changes in the system. And so honestly, we've really come together as a system. So we have our operational leaders working alongside of technology team. Again, the informaticists are going and volunteering their time. So it's really come together as a close collaboration. The call that I just got off of at 1 o'clock had approximately 250 people on the call to participate.
Wow. And it's amazing that your people are stepping in. Does that create challenges, just knowing who's actually available and who's actually working on what when you're, I assume the requests just keep coming at a pretty significant pace. How are you managing that inflow of requests for maybe a new screen, maybe a new analytic, maybe a new, standing up new services in a parking lot and those kind of things? With the changing dynamic of the number of staff you have available?
So we also have a daily call from the information systems leaders. So basically all of the vice presidents, the managers and directors, we have a call at 5 o'clock to discuss what the asks were from that day so that we can make sure that we're managing them internally so that I'm not promising that the informaticist can do something when the CTO may be saying that there's something else that we could be doing with our team members. So at 5 o'clock, we are coming together to create a standardized communication template of all the asks and what we've accomplished through that day, and then anything that we might need to prepare for the next day. And then, of course, looking weeks ahead. For instance, we are working with an organization of how to work from home, so a work from home program, and how to support that. And that many of our employees are able to VPN in, but we did not have enough VPN licensees. So we had to expand that. We went from 500 users to 3,000 users so we could support work from home for an additional 2,500 people. That's
also staggering. To scale that quickly is pretty staggering. Let me ask you from a build standpoint, are you building a lot of screens and a lot of things? And are there certain dashboards or things that you have had to stand up rather quickly that you think other health systems would benefit from, having stood up or being prepared?
Yeah. So we are, of course, are monitoring the data. One thing that we built was the way we built the orderable for COVID-19. We then created a dashboard to see how many people it's been ordered on. So to have that closed loop communication to make sure all of those labs are followed up appropriately. That has already been built. We've also, in terms of screens, we have not built any new screens. We are, although we, when you log in, we're giving an update of what was communicated in that 12 o'clock call. So it's been asked that we refresh the computers at every shift change, just so the nurses are aware of any new updates that are coming from the system, because those front-facing screens, when people log in, will be updated every shift.
This may seem trivial, but I'm going to ask it anyway, which is, Coding. How are you handling coding? Because there's a whole new set of codes that just got dumped on this as well. Was that easy to set up or just standard practice?
So, yeah, I mean, we're doing standard practice as best as we can with any of those. We have relaxed some kind of our change requirements. So typically we have, a change freeze and a release date. However, we've been really relaxing all of our release dates. We're basically, instead of waiting the week in order to do appropriate testing and validation, we're testing and validation in the same day that we're releasing any changes.
Yeah. Final question. I mean, you're in a beach community, and we've seen the pictures from Fort Lauderdale Beach and other things to that effect. Does that create any distinct challenges for you? I mean, I'm sure there was a whole bunch of spring break people that were either here and traveling through the airport and whatnot. Does that create any distinct challenges in that environment?
Yeah, so we are seeing, we also have some cruisers. That includes our own employees. We've had multiple employees that have just recently come back from a cruise. Now the CDC guidelines say that anyone returning from a cruise within 14 days has to go home and self-isolate for 14 days. So it's affecting our employees. However, the city has been very adamant about closing down public places. All of our restaurants are closed, and so they've really been trying to close down the public beaches as well too.
Absolutely. Well, thanks again for taking the time. I really appreciate it, and I appreciate all the work that you and your team are doing in the region. Thank you very much.
Thank you. Take care.
That's all for this week. Special thanks to our channel sponsors, VMware, Starbridge Advisors, Galen Healthcare, HealthLyrics, and ProTalent Advisors for choosing to invest in developing the next generation of health leaders. This show is a production of This Week in Health IT. For more great content, check out the website, thisweekhealth.com, or the YouTube channel. If you want to support the show, best way to do it, share it with a peer. However you do that, go ahead and do it. Share it with somebody, let them know that you benefit from the show. We're going to be back again with more of these episodes this week and probably into next week if I thought about it. So please check back often. Thanks for listening. That's all for now.